as AC mentioned, the study builds on a series of reports that we've done here at the Permanent Forum that were presented in 2023, 2024, and 2025. Each of those studies served a specific purpose. In 2023, we introduced the concept of Indigenous Determinants of Health framework, grounded in Indigenous holistic and intergenerational worldviews in connection to Mother Earth, and centered on the concept of indigeneity as a determinant of health. We identified specific risk factors and protective factors that shape Indigenous well-being globally. In 2024, our study then moved into how to operationalize this. It asked a practical question: how do institutions implement the UN Declaration on the Rights of Indigenous Peoples provisions and provide cultural safety for Indigenous peoples? And it provided concrete guidance on how to meaningfully engage Indigenous leaders in full policy cycles, modifying structures and decision-making processes in accordance with Indigenous rights. Then, last year in 2025, we introduced a measurement instrument, a tool that allows institutions to evaluate whether they are complying with Indigenous rights and if they are structured to create culturally safe systems that address the Indigenous determinants of health specifically. So we have built over time 3 key pillars: a conceptual framework, an operational guide, and an evaluation instrument on the Indigenous determinants of health. Now, this study in 2026 represents the next step, as it brings all that work together to show how Indigenous health is not only a sector, but a reflection of how entire systems are functioning. The study shows very clearly that Indigenous health is not produced in isolation. It is shaped by decisions across multiple domains: climate, biodiversity, food systems, language, governance, and knowledge systems. And I think we heard about this so much on Tuesday during the theme specifically. We heard about all of the ways that Indigenous health is affected from around the globe, from Indigenous people around the globe. These current domains are far from operating in coordination, though, across the UN system. They're very often fragmented. So what we see in this study is that Indigenous health becomes a diagnostic tool to shed light, to assess whether systems are aligned or whether they are pulling in different directions. So, for example, a policy may advance biodiversity goals, but restrict access to traditional lands for Indigenous peoples. A food systems initiative may increase production, but undermine traditional diets. A climate intervention may reduce emissions, but displace Indigenous peoples off their homelands. We've seen that in Kenya in the past year. So when we look at Indigenous health outcomes, we are seeing the cumulative effects of these decisions. And this is why the study reframes Indigenous health as a cross-sectorial system indicator, not just something we measure at the end, but a signal to understand whether systems are functioning overall. The study also identifies 2 more core structural issues: fragmentation and the conflation of Indigenous as rights holders with other stakeholder groups. We face fragmentation of our issues and priorities across institutions, across mandates, and across policy processes. And importantly, the burden of that fragmentation falls on us as Indigenous peoples. The burden becomes heavier because we, rights holders, as per the UN Declaration on the Rights of Indigenous People, are forced to negotiate our priorities and representation with groups of stakeholders who are not related to us and don't share our values or visions in systems, and they force us to work together. What we're proposing is not the creation of a new system here, but a shift in how these existing systems work together, a shift towards coherence, coordination, accountability, and using the Indigenous Determinants of Health framework